Thank you, Annette, so much for inviting me to share and be a part of this. I'm excited to be here. This is going to be a little bit more of a dynamic session. It's super hard to do a session on movement without movement. So I am going to invite some exercises throughout. If you're comfortable and want, I just realized I was going to invite you to turn on your camera, but I actually won't be able to see you. So you don't need to do that, but you're welcome to. So my topic today is breathe into movement, move into healing. And I kind of broke down some objectives just to look at the importance of this concept, looking at the body's rhythms, making sure that we have a sense of safety when we're moving through the world, looking at the body's senses and how do we regulate that nervous system. Obviously experimenting with breath, as is in the title, and kind of looking at how that's going to relate to our core. And then looking at bilateral movement, meaning both sides of the body, and vestibular movement. So if you're not aware of vestibular sensation, I'm going to go over that. And then we're going to kind of tie it into Tango. So who am I and why Tango? I have always really valued teaching as a learning modality. I've loved teaching at conferences, doing presentations in grad school, being in theater, being a mentor. I just feel like there's so much that can be learned through the process of teaching, and that's why I enjoy teaching Tango. So as Annette said, Tuesdays at Red Chair, 7:30. I'm looking forward to this hunker down being over. But for now, happy to practice in my living room. I'm an occupational therapist. So I work with individuals to try and do the important things in their daily life in a way that really allows them to feel successful and empowered. So that means I'm identifying challenges and giving them opportunities, turning those challenges into ways of looking at the world and how can we do this differently. I specifically have an interest in a lot of somatic movement, kind of a same thing in the wording there, but essentially what I love about Tango, yoga, and Tai Chi, of which I have varying levels of ability, is that there's flow in all of them. There can be. It can be very fluid. It can often and most effectively be connected to the breath. And it really engages the body. So that somatic piece of acknowledging where the body is in space. I also acknowledge that I practice mindfulness, and a lot of the concepts I'm going to be using today sort of sink into mindfulness in a very non-secular way, just building awareness. So what I'd like to start with is noticing some sensations. So I'm going to tie this into Tango as I go. So where you're sitting, wherever you're at, let's all just take a deep breath and just notice. What are you aware of in your body? You don't need to change anything. You can. But just kind of notice maybe what your range of motion is. If you kind of started at your fingertips and moved up, what would that range of motion look like? Do you feel any discomfort? So I want that to be the foundation of this talk. Just really paying attention to our bodies and absolutely taking care when your body's asking you for something, whether it's movement or breath or water. Cue water. So there's a beautiful way that we can very easily connect to rhythm, and that's through the body. I don't know about you, but I don't really have to think about breathing. I'm grateful for that. My heart beats on its own. I use this image because the pulse is a wonderful way to kind of check in with the body rhythm. If you're not already aware of how to check your pulse, you can kind of use that visual. I like to spread out my fingers and kind of reach them back, and you can get that that joint right there, that ligament, and then just move toward the thumb a little bit and you can find your pulse. You also blink without really recognizing it. Hopefully most of us can swallow without much effort and walk and move. Our sleep and wake cycles or rhythms, our digestion hopefully is in a good rhythm. So I'm going to invite you to look at this tree for a moment. Just bringing your attention to the tree, to the leaves, to the branches. Mostly I'm going to ask you to focus on the tree. But what I'd also like you to notice is every time you blink. I don't want you to force it. Just notice, maybe just say blink in your mind. Blink, blink, blink. Notice for me that when I blink and say blink, it makes me want to blink harder somehow. I don't know about you. And so I'm curious what else you noticed. What else kind of stood out? One of the things that being really grounded in the body's natural rhythms is that it can invite an awareness of the discomfort that we have, whether it's a physical discomfort or an emotional discomfort. And discomfort is uncomfortable. It's in the name. So recognizing that we have a culture of numbing discomfort, of noticing discomfort and wanting to change it, of feeling discomfort and judging, this is bad, this is, you know, I need to do something different. And so what I'd like to invite is that we maybe establish an awareness around that habit and see if we can just notice, take away the judgment, take away the movement in response to it, and just notice. It's a practice in self-soothing, and there's a lot of recommendations around noticing that sensation without trying to change it. So for just a minute, I can go back to the tree, maybe. There we go. Something nicer to look at. Just for a moment, I want you to take a deep breath again. Connect to your body. Notice the in and out. And then notice something that maybe is uncomfortable. Maybe it's pressure or an itch. Maybe it's an emotional discomfort, something's bothering you or something's on your mind, and just notice it. Sort of make space for it. And see if you can breathe into that sensation. So what this allows is us to be empowered in acknowledging the body's processes, the brain's processes, the heart's processes, and taking a step to make that sensation just part of us. It's just there. It doesn't define us, but it's there. So what I'd like to do is take us into Tango a little bit. So I'm going to play technology, pause share. I'm going to invite you to join me, whether you're sitting or standing. I guess I had it where I needed it. Thanks for bearing with me. Let's just do a couple shoulder rolls as you're comfortable. And then this is an exercise I do in the morning, but what's nice about it in Tango is that it allows you to show up in presence. It allows you to show up in a way that you're strong and you're ready for movement. So what I do is I reach my hands up over my head and my arms are right by my sides. And then I bring them right back down into what I'm going to call cactus position. My elbows aren't forward because that would bring my scapulas forward. And my elbows aren't back because that would bring my scapulas together. And so what I want is to notice that my scapulas go up when my shoulders go up and come down when my shoulders come back down. So let's try it together. We can go up and back down. And this really opens up the chest and allows for better breathing. And if you feel tightness, don't go too far, go slower. I want you to take care of your body as best you can. I like to connect this to my breath. So I breathe in as I reach up. I breathe out as I reach down. I personally use this before Tango. I also just use it before the day. It could be used at any time. You can do it in a bathroom stall really easily. If you ever just kind of need to connect to your body and realign your posture, I'm not sure if you've heard of power poses, but really it can be very empowering to find that state where your chest is open, you're breathing deeply, you arrive fully, right? If I'm kind of hunched over, especially if I'm hunched over all day at work, I've been doing a lot of virtual visits with what's been going on. It's super helpful to bring myself back to this really open position. So I'm going to resume share. So now I'm going to talk about the senses. I used to teach preschool and I loved it. So fun. And we would do a lot about the senses. There were songs, there were, games we'd play. And at that stage in my life, I was aware of 5 senses. If this was interactive, I'd invite you to throw them out there. So I was aware of sight, smell, sound, taste, touch. As I came into occupational therapy and started working with individuals on movement, I became aware of 2 more senses. Vestibular and proprioception. So the sense of vestibular, or the vestibular sense, is that sense you have of balance in relationship to gravity. So moving your head in any direction, your vestibular sense will be like, okay, I'm facing this way. This is the sense that's responsible for dizziness, ultimately nausea, if that is a sensitivity for you. But it also can help you to know where you are and to adjust. So if you went to take a step and it was further down than you thought, your vestibular sense is going to help you adjust. Then there's the proprioceptive sense, which tells your body where it is through the muscles and the joints. So I like this little image of a rock climber here. Just really being aware and recognizing that the body needs to know where it is in order to be functional, in order to move well. Just recently, I started to become aware of an 8th sense. And you'll have to forgive my little graphic here, but interoception. So this is our awareness of what's going on in our body. It's our awareness of how our organs are functioning, about whether we need to go to the bathroom, whether we need to eat, whether our breathing is really tight. And being aware of these things, some of us may take for granted, but others, it may be a significant part of their life, especially someone who may be living with TBI. So I wanted to bring this in because sometimes I work with children who are very sensitive to sensation. They take in a lot all the time. They're super aware of light, very aware of sound, maybe dizzy or having they're not quite sure where their body is. Their proprioceptive sense isn't really on. And so that movement that they're doing is to try and get a sense, where is my body? So with all these sensations coming in, and being very loud, the sensations of interoception, those sensations of have to go potty, I'm hungry, those aren't so loud. They're muted along with all this other sound, all this other input. And what can happen is that, well, as you can imagine, we don't meet our body's needs. So what I'd like to do is invite you in your own time to kind of become more aware of your interoceptive sense. And what this can do is it can empower you to make a change when you need to. So say the room is too bright. What can you do, right? Can you put your hood over your head? Can you gaze at a darker space? Maybe you can dim the lights, but just really giving yourself the opportunity to be aware of all your sensations so that you can make a choice to keep yourself in a healthy and a balanced state. The way that interoception is also important to look at is how much breath we're getting, right? So coming back to the breath, if our chest is really tight, or maybe we're anxious, which is making our chest feel tight, it can sort of ignite all the rest of the senses. I heard some other presenters talk about the vagus nerve and the importance of regulating that vagus nerve and making sure that we're not activating a response or an alerted response to our system if we don't need to, right? So how can we use the sensations that we're experiencing to calm the body, to be present, to be engaged? The less noise that we're receiving, the more we can compartmentalize. Yep, I see that light. I'm gonna go to the bathroom and take care of that so I can be present. The better we're gonna be able to attend and focus and be engaged. So in Tango, it's important for you to be aware of your posture, as we just covered. Having that open embrace. And then from the bottom, and you can do this in your chair as well, having your feet fully on the ground, but seeing if your weight can move forward to the ball of your foot. Right, so what does it look like to have your weight, or how does it feel rather, to have your weight more in the ball of your foot than in your heel? What I'd like to do with you is look at the hips. Hopefully you can still hear me okay. I want you to think of the hips as a fishbowl, if you will. So we're gonna think about, you can also do this in your chair. If you're familiar with cat-cow in yoga, it's the process of tilting the hips forward and tilting the hips back. Forward and back. What we want is to find a neutral position. So just like we want a neutral but activated position on our shoulders and a neutral but activated position in our ankles, in our feet, right? Because we're moving forward onto the balls of our feet. We want a neutral position in our hips. So we can kind of reach forward if you're in a chair or standing. Think about breathing in as you tilt your hips forward and breathing out as you tip them back, and then finding that neutral place. For me, for Tango, this gives me a sense of balance and it clears out all those other sensations. I'm not paying attention to what's all that other stuff going on because I'm super tuned in to where my body is, being forward or back. And that allows me to receive information from my partner. A lot of ballroom dances are danced where partners move together like this. Tango is more of an A-frame. It's subtle, but there's an A-frame. And what I like about that is that not only do you have to be aware of your body and make sure that you're not being noisy in your movement, but you have to be aware of your partner's body. Whether you're a leader or follower, to know where they are in order to stay connected to them. And the stronger that sense of proprioception it is, your sense of proprioception, the easier it's going to be for you to clarify that to your partner and hear it from them through your joints, through your muscles. I like the way one of my favorite tango teachers puts it. She says, proprioception in tango is kinesthetically feeling what's needed to maintain connection with your partner. So really being aware of your body. So let's talk about what that's going to mean for us. We're regulating these senses. We're feeling into what our body's needing, what the sensations are. One of the activities that I'm not able to do right now with coronavirus is volunteer in the NICU, where I go in and I hold these tiny babies who should still be in the womb, or at least they're not able to be in the womb anymore, and they're in a world that's much different from where they were. And so I like to think of bringing in sensation that's very natural, very neutral, very calm, right? And I want to avoid all that noxious sensation. So I'm not going to bring in synthetics. I'm not going to, and you could think about this in your life too, like having a sense of how do I help myself regulate? I want to get rid of those noxious sensations that aren't natural and neutral, that don't easily allow me to connect to my breath, that aren't easily rhythmic, right? You think about a caregiver rocking a baby. It's very rhythmic. It's very soothing. It allows the baby to be calm. Again, this is going to stimulate the vagus nerve and allow the body to relax. It's going to cut off that high alert system. So what I'd like to do, and I'm not sure how well this is going to work, is play a song. And I want to see if we can listen. See, I'll stop the share. I want to see if we can listen to the music and kind of hear the rhythm. Annette, maybe you could give me a thumbs up or something if you can hear this.
Nope.
Nothing?
Sorry. Nada.
Nada. Okay. Let me, so I know that if, oh, here we go. Let's try again. Yeah?
It's super, super faint.
Okay.
If anybody else can hear it and it's just my computer, you know, please chime in.
You can hear it?
Not really.
All right. Well,
Sorry.
we tried, didn't we?
Can you
That's all right.
describe it? What was I supposed to hear?
So I was playing some tango.
Oh, yeah, no, sorry.
That's okay. No, that's okay. So what I wanted there was for us to use that auditory sense to connect to the rhythm of tango and really just give us an opportunity to hear the downbeat and to see how the body responds to that downbeat. Without music, I imagine you can come up with your own downbeat. You could follow the rhythm I'm creating right now. I'm not listening to anything. I'm just creating a downbeat. I like to think of that rhythm as circular versus a stop and go. So I don't ever really stop on that downbeat. And the way that this can relate to our life is using that downbeat, whether it's made up or in the sound of your walking or in the sound of the birds, right? It might not be a super clear downbeat, but you can take the sensations around you and give yourself something to focus on and stay rhythmic, right? So the more rhythm that we have, the more relaxed our body can be. So I imagine others, other than myself, listen to music as a way, let me go back to sharing my screen. use music as a way to calm, use music as a way to alert. So I like to think of some of these tools as ways to regulate my nervous system, ways to empower myself to make choices that help me be in the state that I want to be in. More often than not, we're talking about calming the nervous system, but a lot of the times there's a need to alert. There's a need to come into a different state that allows us to be focused and be engaged and to participate. And certainly following your own sensation is absolutely recommended and an option. But if, let's say there was an important event that you wanted to go to. I'll use this presentation, for example. Say I wasn't up for this, but I had committed to it, I'd agreed to do it, and I was just feeling really tired. I might do something to alert my nervous system. I could use music for that. I could use some upbeat music. I could also go for maybe a brisk walk. I could use some alerting essential oils. So there's lots of ways that you can bring sensation into your world in order to support your alert or calm state. In tango, bringing it back to the rhythm, bringing it back to the downbeat, we have to be aware of ourselves and the way we're experiencing sensation, as well as what our partner is experiencing, as well as what's going on in the room. So there's a lot to kind of think about there. So let's talk about how the brain and the body are going to work together to make this happen. When I work with infants, or when I worked in a hospital setting working with folks recovering from an injury, we talk about the importance of having stability before mobility. So if someone isn't feeling very stable and I'm asking them to cut an apple with a knife, I'm asking them to do something kind of dangerous. So what I do need to do is make sure that they're stable. I'm not asking babies to cut things with knives, for the record, but maybe clapping blocks together. That can be hard for an infant who's not yet sitting up. And so what our brain needs in order to really have that sense of stability is oxygen. I imagine this doesn't come to a surprise to anyone. But bringing that oxygen into our muscles, bringing it into our brain uses 20 to 30% of our oxygen intake. That's a lot. That's a significant amount. I think about, that visual of our body is made up of 70% water or whatever it is. Like we're not filled up to here with water and then the rest is, other stuff. But like, if you think about it, our brain requires oxygen to engage. And the more oxygen our brain has, the more ready it is and responsive it is to do the things that we're hoping and wanting it to do. So efferent neurons, which are the ones that make the movement happen, these are the neurons that send the signal for me to reach my hand out or to take that step in tango. These are the ones that really, if you think about it, if you take a deep breath before you jump off a cliff, maybe like into the water, or before you lift something heavy, that breath is sending oxygen to your brain, sending oxygen to your muscles, and giving you that extra input that you need so that you can do that activity well. One of the things that we can come into when we are struggling with pain or stress is that we reduce our movement. We tend to kind of maybe get into a rut, whatever you call it, where we're not moving so much. And the problem with that in the brain, in the muscles, is that if you don't use that movement, you're going to lose it. The brain's gonna stop firing those signals. They atrophy. And so even if you're not super excited about being active, if you can oxygenate your brain on a daily basis, meaning really intentionally bringing oxygen into your brain, deep breaths, diaphragmatic breathing, you're gonna give yourself a chance to keep those neurons firing, keep your muscles strong. And it's not too difficult. It's something you can do while you're lying down. You can do it while you're sitting. You can stop in the middle of your day and take a few deep breaths. I'm not sure if anyone's familiar with oxygen therapy, but what you can do on your own without any assistance, hopefully, is some diaphragmatic breathing. And essentially, what that means is when you do take a deep breath, you can sort of notice where your body goes. So if you put a hand on the belly, maybe one on the chest, and take that breath in, notice the movement, right? I think a lot of the time we notice a forward or outward movement. I want to challenge you to put your hands on your sides, right around your waist, and take that deep breath and see if you can make that deep breath extend to the side. Maybe even on your back. Can you make that deep breath expand from your back? Can you give yourself a little, oh, you can't see me. Can you wrap your arms around your belly and your back and take a deep breath and feel movement in all of it? Right, and what this does is it brings your diaphragm down so that your lungs can fill completely, and it catches those blood cells at the bottom of your lungs. I'm going to talk more about that are really oxygenating the rest of our body. Now, it's no surprise that when we're calm, right, when we don't have that tension or anxiety in our chest, it's easier to breathe. And then we get calm because we're breathing, we can get calmer, right? And so there is this cycle. I wanted to make like a cyclic sort of an image, but you can also catch yourself. If you're not calm, remember that you always have your breath. It is always there. And it can be harder for some of us to catch that breath and slow it down, but try a hand on the chest, a hand on the belly, and see if you can move the breath from that space. It's pretty uninvasive, unintrusive to what's going on. Let's see. Oh, here we go, right. So what I'd like to do is kind of challenge the muscles of your body without doing much. So if you're sitting at a table or there's something in front of you, listen for a moment and then we'll try together. What we're going to do is act like we're going to push it. So what we're doing is thinking about pushing it and maybe activating everything to push it, but see if you can move none of your body in doing it. So I'm calling this sneaky pushing. And what I find, if I'm explaining this well enough, is that what ends up happening is I engage all the muscles, all the muscles in my body become tense, and I'm pushing the object in front of me, but my arms aren't moving, my body isn't moving. There's just a sense of activation throughout the body. So in Tango, what happens is we connect to a partner and we move toward them in just a little bit. And then in order to take that step together, we have to push or press into the floor while pressing into a partner. So it's like this stretch in both directions, but it's very subtle. I'm not leaning or pushing against them, and I'm not gonna hurt myself pushing into the floor. It's this activation of alerting the muscles that something's gonna happen. And again, with that proprioceptive sense of my ankles, my hips are at that state, my shoulders are back, it goes through the body very fluidly and allows for a very subtle movement in Tango. I just realized you can't see me. I'm gonna do that again. So we're all the way on one foot and we're in this alignment and we go to reach toward our partner while pushing against the floor. And so there's this activation, it's very subtle, but all of the muscles of the body are engaged in that movement. You can do this while sitting. You can think about pushing into the floor and maybe getting taller. And just notice the way that your body moves. I find it most effective to push into the table but without actually pushing the table, just you're thinking about it. And so then everything is activated. So I really liked this diagram. I don't know if you can see those, but I liked this diagram, and I liked looking at how the different brain functions are affected by a traumatic brain injury. So before we can get into the movement, we have to acknowledge what's going on in the brain. And I really want to bring our attention to executive functioning and sensory processing, and ultimately emotional regulation. So as you can see from this chart, that executive function is coming from the frontal lobe and the temporal lobe. We can get that lack of focus, the irritability, memory problems, organization problems, time management. The sensory processing is challenged in the occipital and the parietal lobe, as well as the cerebellum. So maybe blind spots, or having trouble or sensing too much pain, difficulty with balance, right? The cerebellum is where the balance is held. And I also acknowledge that the brainstem, right, is where those autonomic processes are happening, those organ processes, that interoception, where I'm aware of what my body is doing. It can be challenged when there's a brain injury. And so what I acknowledge is that when these things are happening, I can get frustrated, I can get confused, it can be scary, and I'm going to end up feeling this sense of emotional dysregulation. Right? And so all of this is to say that if we can find a way to notice when these things are happening and catch that sense of emotional dysregulation and come back to the breath, come back to something that we do have a sense of control over, something where we do have a say, where we can make a change, it's gonna make it a little bit easier for us to manage these things. I really like to think about the oxygenation process or the deep breathing process as opportunity for kind of lifting myself up. Extended exhalation exercises. So that's going to be singing in the car, in the shower, when nobody's home, when everybody's home, humming, whistling. These activities all extend the exhale, and in support, they extend the inhale, right? So you're helping your breath to slow down. So maybe next time you start to get a little bit dysregulated, whether any of these other challenges, these executive function or sensory processing challenges are happening, or maybe it's something emotional just in your life, how can you hum or whistle, or again, come back to the breath, but give yourself that chance to use a tool. Yeah, so now I want to look at movement. So I worked in a school setting that helps children who had learning differences. And one of the wonderful things that we did were all of these bilateral movement exercises. If you're familiar with brain gym, it's mostly based off of that. And what happens is when we're using both sides of the brain hemispheres, we are more engaged. There's more neurons firing. So I want to start with this exercise. If you put your hands out in front of you and cross your wrists with your pinkies together. And I want you to bring your palms to themselves and interlace your fingers. If that's painful, please don't hurt yourself. You can interlace them loosely. For anyone who didn't catch that, so wrist over, pinkies together, palms down toward the floor, and fingers interlaced. I want you to tuck that hand in. Now take a look at that middle finger on your right hand and just raise it up. I don't know about you, but sometimes what happens is our brain signals don't go to the right place. And so when we activate both sides of the brain, we can be really clear about which direction our body is moving. I really like that exercise just to kind of bring that point home of like, there are two sides of the body, and there's visual awareness and there's proprioceptive awareness, but even still lines can get crossed. And so how can we engage both sides of the brain? You can use what I call a hookup. So that's what Brain Gym calls a hookup. So that's that activity we just did, plus your ankles crossed over each other, and you just kind of hold it. Just hold it for maybe 30 seconds, maybe a minute. Again, this is something you can use at any time without kind of being too invasive or too obvious. And what it does is I like to give myself a little squish. It helps the brain remember there's another side. So the right side of the brain is responsible for the left side of the body, left side for the right. And when we force it to kind of mix together, right, we're crossing midline, we're inviting it to recognize that there's more. There's more to think about. There's more to be aware of. There's more neuron firing at that point. And so the benefits of that is that we have more attention to what we're doing. It can relax our sensation, and it can improve our focus. So we use this a lot with kids. Another fun one that we would do with them is the cross crawl. I'm going to show you this one. This is also something you can do in your chair. I'm going to do it standing. I think you can see me. So right hand, left knee. Left hand, right knee. Right to left, left to right. And again, what this does is it wakes up the brain. It says, hey, this is a little bit more difficult than I think. You can do elbow, you can do wrist to ankle, you can do backwards, right? And what this does is it wakes up the brain, and it gives it a sense of paying attention, right? Being alert, getting out of that rote process of just doing things the same way every day. Similar with trying to brush your teeth with your non-dominant hand. That can be really challenging at first, but it's not, hopefully, if you have that option, it's not impossible, it's just different, and it's retraining the brain. The other one that you can try is lazy 8s, where you follow your finger in the shape of an 8 in front of your body. And so you watch your fingertip as it makes the shape of an 8. And the eyes are going across midline. Your hand is going across midline. And that 8 that crosses through the middle is just giving you that sense of having to acknowledge both sides of the body. One of the other ones the kids really liked was we would take 2 markers and then have to draw the same picture on both sides of the page and be very cautious and aware of like, where's that pen going? That's kind of a fun one you can try on your own. But what this does is it can improve our sensory processing. When the brain is in that alerted state and when we're really engaged, we have a better sense of where our body is, what the sensation is that's coming in. We can process it a little better, and then we can focus. This helps with vision, this helps with hearing. It also helps with posture and coordination. Again, because of the reduced sensation, the reduced sensory input, and then it improves that focus. So I want to bring this to Tango and acknowledge that Tango requires balance on the axis. And what that means is that anytime you're dancing Tango, you're always on one side of the body or the other. And it's hard for me to do this with this camera, but all of my weight is over here. This foot is free to do whatever. I'm 100% balanced on this leg, and this foot is free. You can also shift to the other side and do the same thing. What this allows for is the opportunity for me to follow my partner's lead to go this direction, or this one, or this one, right? And it gives me that chance to really be receptive to what my partner is inviting of me. It requires a very strong axis. It requires that proprioceptive sense, and it requires that ability to have balance, to be able to shift from one side to the other. The other interesting thing about Tango to me is that while you're on that one foot, you really have to activate that foot in a still position almost, and then take a step. So your body is doing two different things at the same, or each side of your body is doing two different things at the same time. So it kind of alerts that extra sense for you. So what I'd like to do is give you a little mini lesson. I guess I'll put this, pause, share, yeah. A little mini lesson on how you can bring Tango home. So, can't see my head. You don't need my head for Tango. You're arriving grounded. Your posture is open. You have activity in your muscles, right? We did that exercise where we're here. We're tuned in to the sensory experience. I'm aware of what my body is doing. I'm aware of what's going on around me. And I'm breathing in flow. And I'm really on a balanced axis. So 100% of my weight is on my right foot. I'm softening my alignment, right ankles, my hips, my shoulders, very soft, very neutral position, even through my neck. But I'm engaged, totally engaged on this side. And then what I do is I press through the floor with this leg so I can move with this leg. So it's really pressing and then moving in one fluid movement and arriving on whichever foot where I landed. And then I start again. So I take that movement, I arrive and I land. Extend, arrive and land, resuming that posture. Ideally, we would do this in person, but because we can't, you have to come to the red chair on Tuesdays. And that's all I have.